have that?
Yeah, right.
It's got the hemorrhoids. Okay, so here we have, I just want to show you guys, there's not a whole lot to learn on here. But here's the rectum, well, the rectum's here, and then the anus leads to the outside, okay? Here are your anal or rectal columns, okay? Do you see these? Pretty good? Okay, and then you have your internal sphincters, and your external sphincters are coming down and around. Okay? And then this is a hemorrhoid, colitis, polyps maybe? I'm not sure. Like I said, I think there was a sale at the pathology lab. Oh, thank you. So here's your thing. So colitis, yep, polyps. So fungal polyps, and then hemorrhoids. Okay? You guys don't need to know this though. Alright, so I think that takes care of the digestive system, so let's move on to the urinary system.
Bless you.
Too close, huh?
It's good.
Okay. You guys see this pretty okay? Okay. So blood flow comes into the kidney through the renal artery. Then we have our segmental artery, interlobar, arcuate, and then you have interlobular. Okay? And if you notice interlobular, connect with our nephrons. This entire region is known as the perikymata. Okay? Perikymata is divided into the cortex and the medulla. Okay? We have renal columns that are the cortex moving in between the pyramids, and then the pyramids are part of the medulla. You understand?
Mm-hmm.
Okay. Now we have the minor calyces draining the pyramids. Where you have two minor calyces or more come together, this is a major calyx. Okay? Minor, minor, major. Okay? Here's a minor just draining. This region here where you have the majors coming together is the renal pelvis. Okay? Does that clear some things up for you guys?
Mm-hmm.
And then
what about the sinuses?
The renal sinuses?
Mm-hmm.
And then you have the ureter coming down here.
Okay.
Okay? And then 6 is your renal sinus.
Okay. So, all right.
Okay? Now let's move on and magnify this guy here. Alright, so we have two different types of nephrons. This nephron is a cortical, and this one is juxtamedullary. Good. Now we can see here we have our arcuate arteries. We have the interlobular artery coming towards the glomerular.
You need to move it down a little bit.
Oh, yep, sorry. Thanks for telling me, guys. I just assumed since it was in the screen here. So, arcuate again, interlobular, and then we have afferent moving towards, okay? Afferent, number 6 here, moving towards, and then we have efferent moving away. Now, this model's a little deceiving because you have your peritubual capillaries here, and you have your vas rectus capillaries here. These guys really sit on top of your nephron. Does that make sense?
Mm-hmm.
So that's where you have to have the gas exchange happen. So the peritubual capillaries sit up here, and the vas recta sits down here. Good?
Mm-hmm.
Okay. And if you notice, after the exchange has happened with the nephrons, we then get, well, this is the best. So if the nephron's sitting here, after the gas exchange has happened, then we have our veins. Okay? Good?
Mm-hmm.
So on a big scheme here, we have our proximal convoluting tubule to our descending limb and our ascending limb, which make our nephron loop, or the loop of Henle. Okay? Then you have your distal convoluting tubule to our collecting duct, and then that leads, at the end of our pyramid, we have our papillary duct.
You gotta move it again.
Oh, sorry. You see? Okay. So collecting duct, and then the papillary duct leads out of the pyramid into the minor calyx. Okay?
Mm-hmm.
Okay. All right, here we have a view of our enlarged glomerular. We have the podocytes located right here. Some of your other models show them a little bit better. I'm not going to ask you what's afferent and efferent over here, but what are these cells? Huh?
Distal.
No,
cells. Macula densa.
Macula densa. What do they regulate? Blood. What?
Blood cells.
Blood
Blood
pressure.
cells and blood pressure. Good. And then these are the juxtaglomerular cells. Good. Okay. These guys are going to be your smooth muscle cells that help constrict the blood flow, regulate what's coming into our system here. There's a couple things here that we can label that would get a little difficult for you, but you should still know them. We have our capsule here. Then you have your actual glomerular, which is this entire thing here. Again, the podocytes are on it. This is the cavity here. The entire thing is known as the Bowman's capsule. So I haven't decided how I would ask you those questions yet, but I'll definitely let you know for your practice exam, okay? Because a couple things can be labeled differently here. So, right. So after we have our urine production in the kidney, we have...
Looking for the bladder.
No, I have a bladder here. I was looking for a male and female. Better one than this, but we'll just do this. Okay. So, you guys see? Ureters are going to come down from either side and enter in the trigone region. And again, these are obliquely shaped to help with backflow. This is a female bladder because we're missing a prostate. Okay? And we can see here that trigone made up between the ureter openings and then the urethral opening. Okay? And as you can see here, you have your internal sphincter and your external sphincter.
You gotta move it again.
Oh, sorry. Internal sphincter and external sphincter. Okay? Female. We flip it over, we have a male. They still have a trigone and a urethral opening. Here, though, is their prostate. So this is the prostatic urethra. Okay? Right underneath it is the membranous urethra. All right, and then from there the penis would be here, so it would be the spongy urethra. Good? So those are the differences. And then the last thing I wanted to go over, well, there's two other things. Real quick, your tooth, this is the crown, the neck, and then the roots, enamel, and then dentin, and then this is your pulp cavity right here. Okay. Last thing I wanted to go over is one of these models here. Don't know if everybody's got a chance to look at this yet. These are trying to show the layers of your GI tract here. So what are the three major layers of your GI tract?
Mucosa, submucosa, and muscularis.
So we have mucosa, submucosa, muscularis. This portion right here is the mucosa area, okay? We have what's supposed to represent a prior patch with the lymph, okay? This is your submucosal layer. And then we have represented two different types of our muscles in our muscular layer. We have the circular muscles and then the longitudinal muscles. Appropriately labeled because they look circular here when they're cut in cross-section and longitudinal here when they're cut in cross-section. Okay? Depending on what area you're in, there's also an oblique layer of muscles. If you are ever confused about which layer is the submucosa and which layer is the mucosa, remember the submucosa always has the blood vessels running in them. Okay? Oh, the blood vessels running in them. Good?